Bowhead Futures presents digital health at the front lines. We explore how healthcare is shifting by deep diving with the doctors transforming the system from the inside out.
The current setup at a hospital is such that, the clinicians don't have enough time to support a patient. But it's not just time, it's also the fact that you're not really being paid to do this, right? So you're now being given tasks that are outside of your incentives. And so that's obviously not sustainable. I mean, it might happen here and there, but it's not sustainable for the long term, right? So what does the new model look like? From what I read, there are these, especially in pharma, there are these like values-based models of care where now all of a sudden people are only getting paid based on outcomes or value generated. And in my experience, that's a shift to the whole healthcare system. It's not just pharma, right? Because insurance payers have to be involved in that. Clinicians and hospitals have to be involved in that as well. So it's not just like one stakeholder has to be changing this. It's the entire model that would change. So I'm just curious on your side, do you have any visions of what a future model of care could look like? And is this something that you think will happen in the next 5 to 10 years?
Yeah, I think that change will definitely happen in the next 5 to 10 years. Like maybe post-COVID, it really felt like we had to content ourselves with incremental change, but now we realize, I think we all have had a big shift in terms of what we think is possible. At the macro system level, it is absolutely finding more ways to pay for values-based outcomes. And I think a really good example in the US is Medicare Advantage. The way that is set up to pay a capitated fee based on risk has led to some really amazing innovation in terms of care delivery, where care teams are empowered to say, this is what we've already been paid to have a relationship with this patient, and now we are just going to invest in that relationship. That's what we're here to do. And if they need a music player, so like an iPod to go to dialysis and not freak out, that's what we can do. If they need an air conditioner so that they don't have recurrent asthma attacks, we can do that. It sort of allows a payment for a relationship rather than sort of the widgets. And it allows for accountability too, right? So it allows for sort of a return to like the dignity of doing primary care work, which is saying that, we get paid in fee for service essentially to show up and punch a card for each patient. And with a values-based model, we're really paid to think about what actually is going to make a difference for this patient and how is that going to keep them out of the hospital. I think digital tools are going to be a big part of that. But we also have to think about what kind of care would we want our mother to have, and how does that not get lost in the increasingly fragmented landscape?
Yeah, thank you. That was so wonderful to hear and to feel your heart and mind both working, and I think it's going to allow practitioners to get back to doing what they truly signed up for. But I think it'll also attract the next generation of practitioners who are coming in knowing that they can they can actually wear their hearts on their sleeves. In this new model, I think it'll just be more attractive role, and it'll be all encompassing. And I love what you said, payment for relationships versus widgets.